welcome back to another episode of the Health Hun Podcast. Today I have the lovely Roz. Say hello, Roz.
Hi, hello. Hello, how are you?
I'm good. Roz is over in Perth at the minute. We have done a role reversal. She's over in Australia and I'm back over in Ireland. But you have just moved over there. I first met Roz when I was on her podcast with her friend Becca. And we were chatting about all things like spirituality, trauma, plant medicine, all different things as well. So it was a really, really interesting podcast. So go check her podcast out as well. Can you tell people listening a little bit more about yourself and what you do?
Yes, thank you. So I'm Roz or Roslyn. I always sign my emails Roslyn and I tell my clients, call me Roz. And I'm like, that must be so confusing. I'm Irish and I am a dietitian, online coach, and yoga teacher as well. So many, many hats. And I currently work with Amelia Thompson and Becca, who is Becca, ET PhD coaching. And we offer a combined coaching package, which involves dietetic support and therapy, which I love because I specialize in eating disorders. And I'm really passionate about a multidisciplinary team. So I came from a background where I worked in the NHS in the UK, and I always worked in a team with therapists, doctors, consultants, OTs. And when I first went out working self-employed online by myself, I found it very lonely, and just the type of people I work with often need that dual support. So it's so nice to be able to team up with different people online as well, but it makes you feel like you're working in a team.
I love that. I love that. I want to chat a little bit about the dietetic side of things because I get quite a lot of questions about like nutrition and a career and kind of coaching and working with women and obviously males as well, but obviously my specialty is female, so I get those questions. But how did you find I suppose the career with dietetics is a lot different to nutrition, so you have a lot more kind of regulatory bodies to kind of adhere to and kind of different things that you have to go through in terms of like placement and stuff like that. So can you fill us in a little bit more on your journey going from a student of dietetics to where you are now?
Yes, I'm smiling because I always feel like not a bit of a black sheep in dietetics, but also I've got a very colorful experience. So yeah, I suppose that's where the difference starts, isn't it? So to be a dietitian, we can do undergrad 4 years, or you do nutrition then postgrad. But our fourth year of so it was human nutrition and dietetics was what I studied at uni. The last year, you basically do a whole year of unpaid placement,
Love
and
that.
I love that. And I studied in Glasgow. I'm from near Belfast, so I studied in Glasgow. So all my friends, were doing like festivals, and over the summer I had to go to the arse end of nowhere, like halfway between Dundee and Aberdeen, and I had to go stay in army barracks with no Wi-Fi for the whole summer, and that was the start of my dietetics placements. And people are always like, "Oh, you're so like resilient," and I'm like, "That's just because that's what I had to do. Like, you just had to like get on with it." So whenever you qualify as a dietitian, I do think I qualified in 2014, and I do think thankfully it's changed. So like if there's any student dietitians or student nutritionists, I think career progression has got much better. But whenever I graduated, I basically did 2 years working as a junior dietitian, where I worked in like a busy hospital and I rotated. So there's different rotations you can do as a dietitian, which I'm glad I did it all because it got me to where I am now. So I did medical, so that might be like care of the elderly. I worked in gastro, so people that maybe got Crohn's, colitis, have to get ileostomies, part of like their bowels removed. And I suppose that's the difference between a dietitian and nutritionist, is lots of our degree is about working with people who've got medical diagnosis, because we need to know how to interpret the bloods, because we might actually be supporting people with TPN, which is feeding through the veins. We also might maybe be working with like drug nutrient interactions. So we did like a whole course or module in pharmacology. And then when you're in the hospital wards, it's just all that jargon, like all that medical jargon. So the reason I laugh at my experience is I just got bored, or not being not being cocky. I feel like I mastered the medical placements, and I went into like this surgical placement. And I did 2 years in Glasgow, and I was like, I just don't really know. I don't think dietetics is for me. So I went to Manchester, and then I worked in a private oncology hospital. So oncology, all my people I worked with, they all had some sort of cancer diagnosis. Working in a private hospital was very interesting because I worked with footballers of like Premier League to then people of like CEOs of companies, but then you also maybe had Joe Bloggs whose company gave them really good medical insurance, and they were so grateful. So definitely you have to really enjoy working with the public. I think as a dietitian as well is the range of people. And again, I got bored of cancer oncology, so I was like, I'll try pediatrics. So I worked in a really big children's hospital with like babies that were born with like holes in their heart. So I helped get their nutrition right to prepare them for surgery. And then at the ripe old age of 25, I was like, I'm going to take a career break, or I joke, a quarter life crisis. So I actually took like 2 years off. That was me. But as you said about our governing bodies, I actually took like 1 year and like 9 months off, because if you take 2 years off as a dietitian, you can't re-register with the HCPC. So for anyone out there, yeah, the HCPC is the Healthcare Professions Council. So again, nutritionists aren't on the HCPC, dietitians are, and that's what our accredited governing body is. And every 2 years you renew your profession. And I timed my traveling that I literally went back and I had like 3 months to like keep my registration up, because if you lose that registration, you have to like, I think you have to go back and work again unpaid or like down a banding for 3 months and get your, yeah. So I don't think people realize that, like, being a dietitian, there's a lot of, I don't know if red tape's the right thing to say, because again, that's what allows us to work with people who've got cancer diagnosis or eating disorders. So I suppose when you've got people in those positions, you want to make sure you're working with someone that's got that experience and insurance as well. So I also member of the British Dietetic Association, the BDA, which is for my indemnity insurance and continued practice development. So I took 2 years, but anyone that's thinking about taking a career break, I am going to be like the poster girl for it, because it was like during that time, I was like milking cows outside Melbourne to get my second year visa. I backpacked South America, and I was like, I kind of kept coming back to podcasts on dietetics. I kept coming back to, that was when I started listening to podcasts, like 2019, 2020. And that's when I discovered like intuitive eating. And I'd never heard of intuitive eating as a dietitian before. It was maybe more like my own personal, like, oh, what's this? Because I hated weight management in the NHS. It just, from what I saw, it didn't work. It wasn't the right thing for the people. I didn't enjoy delivering it. It didn't like resonate with me. And I remember like saying to my boyfriend, I was like, I want to work online, and I think I will go back to dietetics, but I want to do it differently. Yeah. And I suppose as well, like, you know, that was 2020 and now it's 2023. So it took me 3 years to like, you know, get there. But that's where patience and persistence comes. So yeah, after I came back to the UK because of the pandemic, because of COVID, I got my first gig job as an eating disorder dietitian, and then in the NHS, which I loved. Like, I would say to any of my peers that want to work in eating disorders, I don't think you can go out and just like do it online yourself. Like, I really like valued, you know, all the experience I got working in the NHS, having like peer support, having like supervision. I still have supervision that I like pay for privately every month. I really value supervision, but getting that experience, and as much, you know, as it's a really difficult job, I've seen some people at their sickest, but I think that's the severity of eating disorders. I think it's really important when you work in this field that you do see the most severe consequences, because it allows you to be like a much more responsible practitioner on the other side whenever like you're working online. Because often I don't see my clients in person, I see them all online. So yes, so I was doing eating disorders in NHS, and then I just started dropping my days. I had a really supportive boss, so I was like, oh, I'll start and work online for myself. So I just gradually went down to like 4 days, then I went down to 3 days, and then last year I left the NHS and went full time online for myself.
Love that. I'm curious to know, do you know your human design?
I've did it before, but I can't remember because yes, I
Are
say
you a
them again.
manifesting generator?
Yes, I think so.
I knew it. I knew it. The fact that you're bored and you're on rotation all the time. I'm also one. And I've so many people in my life that are the same. And it's so funny. You can just spot us a mile off because we always want to be doing different things. Even like I've got my niches, relationship with food and body image, hormones, and then gut health. And even in that, I'm like wanting to learn new things. I'm wanting to be stimulated. And now I'm looking at trauma, and I'm like, I don't even know where I'll end up in a few years' time, because I constantly want to be learning and chopping and changing, and I have all these different tabs open in my brain, and it's so funny to see that in you as well. I love it.
That.
I love
I
it.
had Amelia offers me mentoring as well, and she was like, don't do another course. She's like, just slow down for a minute. I'm like, but I think as well, when you work in this area, like the more we know, the less we know, or like there's just, and there's so much we want to give to our clients. So we're like, this will help them. Like, I know you do like Reiki as well. And like, I was like, oh, I'd like love to. And that's why I did my yoga, because I started off doing yoga like the first time I did a bit of yoga, I dabbled, never had like a practice as such. And then whenever I was milking cows in Melbourne, again, resilience. I started going to yoga because like I needed to. And I really got into yoga, and then I was like, oh, there's benefits of this for like my clients. So then I was like, and I always want to do more. So then I went and did my teacher training, but it was as much, that was my 30th birthday present to myself, was like to do my yoga teacher training. And so yeah, but yeah, I know we'll talk about that later, like all things yoga.
Absolutely, we want to dig in with dietetics. Are you restricted with, like, obviously we all have scope of practice, but if you have, say, the additional skills of yoga and stress management that you learned, are you restricted with what you can advise patients that are presenting based on like you're showing up as a dietitian that day, or can you bring in other skills from other courses?
Really good question. So yes, I can. That's also why I wanted to get my yoga teacher training, so that I could bring it in. But before, when I was just a dietitian, I could talk about yoga, but I would have to put like a bit of a caveat, like, oh, check with a yoga teacher before you do this, or check with your GP. You can physically do it, or check in with like your spirituality, or like what religion you are. If that, like, I always had to put like a little line. But now I feel very comfortable like in sessions to like guide someone through a little seated cat cow, or a little bit of like breath work with their consent. However, one thing I have to be careful of, when I'm selling yoga events on Instagram, there is like nobody, this is where I just think people's egos or get in the way. It did get brought up that I have to be mindful of selling yoga on my Instagram, because as dietitians we're not meant to sell. But so like I sometimes do like yoga retreats, do classes, things like that. But I think it's just the way you word things. And I think I kind of make it quite clear, like, I'm doing this as a yoga teacher. Like, if you're coming to like this event, I'm going to be a yoga teacher for the day. If you're coming to like a nutrition event, I'm going to be a dietitian. So I'm selling the dietetic event, or I'm selling the yoga event.
Yeah.
No one's ever like said anything to me about that, but part of the HCPC is we're not meant to abuse our power in the public to sell, to manipulate the public to buy things. But I think that's a very blurry line. So it is. But they're currently writing new guidelines, the BDA and HCPC, for dietitians, because a lot of my peers are getting like offers with like food companies and supplement companies, and I think it's better a dietitian selling a supplement than an influencer, because at least the dietitian is going to have, you know, that evidence-based research behind it. But I can see concerns that we don't want, you know, to be manipulating the public as such.
Yeah, it's really interesting. Like, obviously there's so many pros and cons, and like there's so many benefits for you to be kind of regulated, because even though what you're saying about supervision, you've got access to that kind of peer support, and you've got literally exactly what you said of like you're dealing with people who are really, really ill, and you know they really need to be like doctors, they have a duty of care, and you need to make sure that the person is doing the right thing. But then there is also the other side of things, and like, would you say that that's the biggest limitation for you with going into a career of dietetics, that you are kind of limited to, I suppose, what you're saying, what hat you put on and when, or is there other limitations that you've experienced?
No, I think well, one currently is insurance. It's been
Okay.
an absolute nightmare getting myself insured to be based in Australia but working with international clients. So when I was in the UK, it was fine, but when I left the UK, even though nothing about my job has changed, it's like it's crazy, so it is, and I've been really frustrated because I've got peers who are like online PTs and they don't have this issue, so they don't. And I was like, well, how are we as dietitians meant to compete with like influencers and like PTs if there's like red tape against us working online in a different country? Like, it's so bizarre. I also think as well, something that I'm navigating is, I think this is changing, but how I show up on like Instagram and social media and like what I say in podcasts. Because yeah, we've got scope of practice and we've got that professional guidelines. But I also think people don't want to work with a robot. Like, they want to get to know me.
Yeah, and you're great.
And the more like authentic I am, I think, you know, like that resonates. But what I'm doing at the minute is maybe I'm a bit more vulnerable on my email list, so people there get to like know me a bit more. And I think maybe that's a bit of like a block of myself. But I haven't had any peers like report it to the HCPC or anything for conduct on Instagram. Like, I think we all kind of know what's professional, what's not. But there has been dietitians report it for doing like paid ads and doing like partnerships. And I don't think that's necessarily something at the minute that I want to explore. But I mean, it would be nice to like, you know, have paid ads, like partnerships. Like, that could be a very like, I don't know why I've never wanted to explore it. Maybe it's just because it's never been an option. But whenever you think about it, like, that could be quite a cool avenue to go down. But and yes, my peers got like reported to the HCPC, got put in the Daily Mail about it.
Wow.
And yeah, and they felt very like victimized from it, because they were like, well, other people can do it. And they didn't have massive followings either compared to like other influencers out there. So yeah, there is like red tape, I do think, at the minute. So there
That's
is.
very difficult.
At the start, I was worried about talking about yoga on Instagram, just because, again, of like, I did a couple of things last summer. I did like new moon yoga, like the full moon yoga, because I use the moons as like journal prompts for me, and like I really like manifest with like the new moon. And I was really worried about putting that out there, but nobody batted an eyelid. People showed up as well, like people like came to the events. So I think sometimes it's also like, you know, working through what's triggering you and like why is that, and maybe it's just hurdles I have to get over myself.
Absolutely, absolutely. Thank you for sharing. Before we move on, can you share, I suppose, for anyone who's interested, like what an average day kind of working in that clinical hospital setting looked like for you. Maybe it's a little bit difficult to do because you worked in so many different specialities, but if you could summarize.
No, yeah, because I think the great thing about dietetics is, and I got this advice when I graduated, it's all transferable skills. So I do think the day-to-day looks quite similar. So usually you go in the morning, and majority of hospitals I worked in, you checked your referrals. So either that'd be like electronically or like paper referrals from like the wards or from consultants or teams. And then you might also have like a team meeting, like a little like 15-minute check-in with other dietitians, like does anyone need support that day, what's going on. And then when I was more junior level, so like band 5, it you 90% of your time was like on the ward. So it literally would be maybe seeing anywhere between 1 to 3 new patients in the morning. If we were doing TPN, so TPNs when you feed through the veins, that might be people that have had some sort of bowel cancer or chemotherapy or maybe had part of their bowel removed. Generally, most hospitals, you have to get that in by like 10 or 11 a.m. because basically you have to get off to the pharmacist, they have to prepare the bag, then like the labs have to make it. So you would prioritize those patients. And then lunch, and then there might be some CPD at lunchtime. So maybe it might be like a rep coming in from like a supplement company. And when I talk about supplements in the hospital, this is more like supplement drinks. So they're like high calorie drinks with like vitamins and minerals for like basically for like malnutrition. Or there might be maybe like a student. There's always a rotation of dietetic students. So there is like every 12 weeks there'll be, so often they present like a case study, and in the afternoon you might see like six patients. When I was like a band 5, I think I seen like, I don't know, maybe like 14 people a day. It was really, really busy. But as you progress and maybe specialize, maybe band 6, band 7, you might have a clinic. So the clinic, you might actually have like outpatients coming in. You might have like 4 to 6 people in a clinic, and it might be very specialist, like an IBS clinic or a fussy eating, selective eating clinic. I shouldn't say fussy eaters, selective eaters. And yeah, then as you get, my last role, I was band 7, so I was like considered in management. So I actually did a lot of funding meetings. So I was involved in a lot of more like, that's maybe when I enjoyed my job less, because I seen less people and it was more like managing budgets. And if anyone works in the NHS, it can feel like you're doing a lot of work and maybe not seeing the fruit of your labor. Is that the phrase? Fruit of labor, yeah. So yeah, I suppose that's what the day. It's definitely a busy job, I would say, and a lot of thinking on your feet, a lot of like record keeping. Like as dietitians, we have to record notes within 24 hours of seeing someone. And the British Dietetic Association have got very strict guidance of how we write our notes as well. So I suppose there's a lot of professionalism around, our record keeping as well.
Gorgeous. Well, thank you for sharing. You mentioned a few minutes ago that the clients that you're working with are really, really sick, and you're seeing them in like the depths of their eating disorder or they've got cancer. Do you get any sort of mental health support as a dietitian?
No.
Okay.
Like, as in, do we get support?
Yeah.
No. So as yeah, so I suppose we can talk about this. So in my last job, my second last job, I worked as an eating disorder dietitian on a ward. CAMS, so CAMS stands for Child and Adolescent Mental Health. And it wasn't just, so it was basically people under 18, generally like 12 to 18-year-olds. This was 2021, so like, the second and third lockdown. So we were full capacity. We had a lot of children, teenagers in with like severe depression, severe anxiety, bipolar, borderline personality disorder. So it wasn't just eating disorders. There was like a whole mixed. And there was an incident where a patient escaped, and I happened to be there when she escaped. And I actually didn't know what to do because I was an eating disorder dietitian. So I mainly just seen 2 or 3 people in the ward, not everyone. And do not do this, like if anyone's listening, but I ran out after the patient because I just hadn't been trained. So I ran, my instinct was like, she's going to escape, like what do I do? And basically I got hit by the patient. So I did. It wasn't like, I wasn't physically injured, but it was like psychologically like very traumatic. And also it was like during a lockdown, so I just had I'd like moved to Wales, I had like no support like to talk about it with anyone really. And I got told that I would get psychological support, like I'd get like I ran through the events with the manager. I never got any counselling or anything after that incident, so I didn't. So I think like it's just I never want to say anything negative, but I think the services are just so stretched for patients that there's any money that there is to be in services go to patients before it goes to staff.
And that's similar, I think, in all hospital settings. Like I remember I used to work in the emergency department, and again I was like a healthcare assistant and an admin worker, and I didn't have any training as a healthcare assistant as well. Like you can do courses and you can I think it's like a level 5 or whatever, but I remember like witnessing different things and just being like, oh my God. And it's so normalized, and the amount of chronic stress that the staff are under, it's awful. I suppose it's a whole systemic issue, and we're not going to solve that here today, but it's really awful that, like, I suppose what you experienced, what all the nurses, all the doctors, everyone experiences, and there's no support there. But yeah, maybe we'll leave that there because that'll be a whole tangent and a rant for a whole other day. Well, I'm sorry to hear that was your experience. But yeah, it kind of is what it is really at the minute. But you mentioned you're doing your yoga and you're doing your moon circles and stuff. Would that have been something you did back then, and it would have been something you tapped into for kind of coping and for kind of, regulating your nervous system and stuff? Or would that have been something that you, I suppose, got into only in the last few years?
Yeah, so I think I was always a bit spiritual, as in I think my friends would always say I was a bit weird, or not weird, like I was always kind of like seeking something, but I didn't know what that was, or I'd always be interested in like horoscopes or maybe like superficial level, if that makes sense, like or new age. I don't like saying new age spiritualism, but maybe like I didn't really know what spirituality was. And whenever I was traveling, so that was like 2019, so like 4 years ago, I think I just had more time. I wasn't stressed. I literally was like backpacking or like milking cow. Like I had milking cows, or like I was an au pair, so I had very like no responsibilities. It was just like make enough cash to go to like the next place. And I don't know, I just started becoming more aware of the moon. Like I know it sounds really silly, but like obviously the moon was always there, but I started being like, I see the full moon, and then like 4 weeks later I'd be like, oh my goodness, it's a full moon again. And I was like, and I know that sounds silly to some people, are like, oh, it's always a full moon, but I think I just like Google something like full moon and women, I don't know, and then I discovered these like journal prompts, and I was like, oh, and I very much like did it by myself. And then I didn't know that other people did this. I thought I was just like a little like this like my little thing that I did. And then I was in Sri Lanka in 2019, and it was a new moon, and I actually like wrote out, like did like full like little session by myself, and kind of like learned about manifesting with the new moon, and really like meditated. Oh yeah, I started getting in, sorry, I'm digressing. Prior to this, I started meditating. So I did. I actually, yeah, I don't mind talking about this because I think this is really important. I was feeling quite stressed, not feeling myself, bursting into tears loads. That was like the warnings. I was just bursting into tears, not really knowing why. So I went to my doctor, who I'd never been to. I think I actually had to sign up to a doctor in Manchester. So I'd been like living there for a year, never been. So I met this like random guy who made me do this like questionnaire, and he was like, you're depressed. And I was like, what? And he's like, you're depressed. And he's like, I'm going to prescribe you citalopram, and I'll see you back here in like 3 months. And I was like, sorry, I've never met you before. And obviously I appreciate probably being a dietitian, working with doctors every day, I had the confidence in myself to say this to him. And I appreciate like a lot of people don't have that confidence or that self-belief, or, you know, how often they speak to their doctor. And I rang my mum and dad. And again, I appreciate this is like quite privileged, but I was like, mum and dad, I've been prescribed citalopram. What do I do? I was like 25. And they both said no to different reasons. Like my dad had heard a story about someone in citalopram who had like committed suicide. Just my dad's a farmer, so like they just hear stories and believe it. So that was that. And my mum, I can't remember my mum's reasoning, but she didn't want me to go on it either. So they were like, we'll transfer you money and you can go to like counselling. Because I asked the GP, could I go into counselling for the NHS instead of citalopram? And he drew me this graph. It was so patronizing. And he was like, you're down here, so you need the citalopram to bring you up here, and then I'll refer you for counselling. And I was just like, at this point, I didn't work in mental health, but I knew of mental health. Like
yeah,
I knew.
red flag. Major.
I just didn't feel depressed. Like I was just really like I knew there was something wrong. Anyway, went to counselling, and she told me about meditating. She also told me about my values. That was the first time I heard about like core values, and like when you make a decision, bringing your values into it. I learned about boundaries, and I learned about love languages. And at the time, I was going out with this guy, and it wasn't a toxic relationship or anything like that, but he just wasn't right for me. Like it's really, when I look back now, it's just funny. It's just like, that was my best friend's like, that was a blip. She was like, that was just a blip in your life. It's fine. What we actually came to conclusion with my therapist was my granny had passed away, and I had flew home for the funeral, and then 2 days later just flew back to work and just acted as if nothing had happened. And she was like, you're just in like grief and denial of grief. And she's like, you're not depressed. She's like, you're just repressed. And I was like, whoa. And so that's probably what kicked off maybe like my like well-being journey and spirituality. Actually, like then the moon came in, because I learned about values, and I learned about meditation. So I was like meditating, just using like Headspace at first, probably journaling with her. So then when I started journaling with the moon, it all just came like a bit easier to me. So it did. And so then I went traveling, and I think just like things happened a lot. Like I just met people in my travels that maybe like were into yoga or meditation, or like had maybe did psychedelics or something. And I just had these conversations. I was like, whoa, I've never met anyone like you before. And I've always been really open-minded anyway. And yeah, I was in Sri Lanka, and I did these like new moon manifestations. And I don't know if I like saying new moon manifestations, because I think now they get like misused, like the word manifestation. But I genuinely 100% do believe in manifesting. I think it's just it gets misused sometimes. And it was September 2019, and everything I manifested, literally, I think I kind of was maybe like testing it. Everything came true within like 4 weeks, and I was like, oh my word, this stuff. like I was like this works, or like, you know, like this, you know, you can really, this really does work. So I just really got into yoga, and I think I just got a bit more like strict with myself, with like my yoga practice, with meditating, with journaling. And I think then actually at times when maybe I've like felt, oh, I might be a bit low mood, I'm able to like check in with myself a bit more and kind of explore that. And I can see how unaware I've been throughout life now that I'm a bit more self-aware. And I'm not always self-aware. Like there's still times I'm like, oh, last week I wasn't very self-aware then, but I'm able to like reflect back on that.
Yeah.
And when I did my yoga teacher training, I actually wanted to do it in India, and then COVID happened, and I think India was shut for like 1 or 2 years. And how it happened was there was a guest teacher in my studio in Wales, and the way she taught yoga, like no one had ever taught yoga like that before. And I was like, oh my goodness, where did you do your yoga? And she told me about Satu. So it's Authentic Flow Tribe is who I did my yoga with. And Satu is the director of the school. The yoga I learned was all somatic experiencing. So all the cues I do, they're not physical alignment. So it's not like make sure your knee is like over your ankle, like, and your right toe. It's all like, can you feel into your sit bone and push your heart out? And I was like, this is what my clients need. Or like, this is what I like. It was all very like embodiment. And I was like, it's funny how I think that's why it's important to be patient with things sometimes in life. Because if I'd pushed to go to India, I maybe would have did, and there's nothing wrong with like traditional yoga, and there's nothing wrong with like strict alignment. But because I kind of like wait it, and then I kind of like find that teacher for like a chance meeting, that I end up meeting Satu, and I was just like embodiment yoga, somatic practices. Like I was like, this is like a new language to me, but it's so juicy. And maybe for anyone listening, like somatic experiencing, basically soma means the body, and it's about experiencing things within your body, because we hold so much stress and trauma in the body, and our body can really tell us a story but also help us release those stories as well. So yeah, sorry, I think I went off on a tangent there.
No, we're here for the tangents, beautiful tangents, and thank you for sharing. And I love how there's sprinkles of spirituality in there, of like waiting for divine timing, and you know, things came to you and all that good stuff, because I think especially in the kind of like science community and dietetics and whatever, we're always kind of like, okay, this is natural career progression, this is what we have to do, and now we want to work in here, and now we want to do this, and and it's like, be open to what's going to happen next. Like, my career is not a straight line at all, and I get multiple people being like, how do I do what you did in your course? I'm like, babes, I can't explain it, it just happened in a weird ass random way. And that's where I am today. And if I had have been like, no, this random feeling I have to go for this job for 6 months doesn't feel, sorry, it feels like it's something I want to do, but logically it doesn't make sense, and it's not what looks good on my CV or blah 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 blah, but I went with that. So I think that's so important, that like, obviously we're all about the evidence, we're all about the science, but you need to be in touch with yourself, and that's what's in alignment for you. Yes, you can see what looks good on paper, but your own life experience is what's going to be unique to you at the end of the day. And thank you for sharing about somatics, because I haven't spoken a lot about somatics on the podcast yet. We're very much like, I'm always like helping people understand the nervous system and helping people understand beliefs and processing trauma and stuff, but we haven't mentioned about the somatics. And even like myself, the last few days I've been feeling very like a little bit of anxiety, and a little bit like, oh, it kind of built up last week before I went on holidays. Then I was fine on the holiday because I was distracted by being in Lisbon and being sunny and around having fun and whatever. And now I'm back, I'm a little bit like, I'm a little bit anxious. I'm like, why am I anxious? And I'm kind of trying to find the reason why. And then I was like, I don't really have any reasons to be anxious. And then I was like, because you're ungrounded. Like, you're not in your usual routine, you're not in your usual you haven't been in your body that much. You've been meditating once a day, which is great, but you have been surrounded by so many different energies, many different places. You're not in your usual environment that is conducive to you feeling grounded and being relaxed and in your body. There's so much different things happening around you. So unless I'm intentional with that now, which I am, as of last night, I very much sat and did my Reiki and very much did some intentions and did different things that I'm going to really try and embody over the next few days. I'm going to try and do some yin yoga, and that's it. Sometimes it's not really about reasons. Sometimes there obviously is clues, and there's things that you need to work through, there's triggers, there's whatever, but sometimes you actually just have to come back and being in your body. And I love that you said about embodiment. And can you share, I suppose, a little bit more? And I'm really trying to get my clients to be in their body. So say if we even use the example of self-objectification, that is automatically you are outside of your body, you're not within your body, you are looking at your body as this separate thing, and you were criticizing, you were body checking, you were shaming, you were doing all these different things. And I had a client call yesterday, she caught up with me for the first time in 2 weeks, and she was like, oh my god, just saying that phrase and having that awareness that I'm self-objectifying around men has helped me so much that I'm able to just like stop objectifying. And then she's just like, I don't give a shit what I look like about men, around men right now. And that one liner has stuck with her, but we don't even realize that we're doing it. We don't realize that we're outside of our body, because maybe we are so focused on the theory, and maybe we're focused on the learning, and we're getting carried away and swept away by our thoughts and our emotions. But being in your body can be that starting place for you to actually feel a little bit safer and a little bit, I don't like using the word in control, because, you know, we kind of want to move away from even trying to seek control in the first place. But I suppose that would be a word that would kind of land and resonate with people listening. But can you tell us a little bit more about the benefits of yoga? And I'd love to hear more about the style of yoga that you do as well.
Yeah. So, brilliant question. I love that for your client as well. So I love that. So yoga, like there's so much research now, which is brilliant, because anytime I talk about yoga on like Instagram or pod, I'm always like, oh, I never remember papers like offers or anything, but it's just so nice to have science to back it up. And I think, as you said, it just goes back to like us, our professionalisms. We've always been taught when you say something, have something to like back it up, if that makes sense. But yeah, yoga, I suppose whenever you're doing yoga, so much of it is cued on the breath. So whether that be like a deeper inhale, or whether that be that on the exhale, you move your arm or you move your leg or whatever that is, and getting really in tune with your breath and lengthen it can be a way to drop in to your body. And one way that I love helping people drop into their body is placing one hand on your heart and one on your belly. And when you take that deep inhale, you know, can you let that breath really travel down to your belly? And I know this can be quite challenging for some clients to have a hand on your belly, but actually that's the first step. Like just placing your hand on your belly and letting your feel your breath move your belly in and out can be really empowering, because you can see that it's not your belly. So it's not as in terms of like how you objectify that or think of it. It's actually just a part of you that's moving with your breath and you as one. And then as well, you know, dropping in to your heart. And maybe sometimes you can actually feel your heartbeat when you've got your hand there on your chest, or maybe actually you can just imagine what your heart feels like. Or another way I like to guide it is, you know, closing down your eyes, hand on your heart, like what colors do you see? What do you hear? Is there a place? Is there a memory? And, you know, maybe it's just loads of colors, maybe it's loads of sounds. It doesn't have to be a person. But again, this can just be a way of letting your body guide what you can hear, what you can see, what you can feel. And I think once we can start to do that and connect with those parts, we begin to see that we're one. So often we think of like this mind-body connection, and we think up here in our head is all our thoughts, and that's where like our relationship with body image is. But actually, once we start to place our hands on our body and really feel into it, we can see that we're one. And I think that's where loads of gratitude can come from. And it's not that you have to love yourself, but it's just beginning to explore acceptance for yourself and acceptance for your body. So practicing yoga, will it be yin, which is like the slow one on the floor, maybe holding poses for like 4 to 6 minutes, or vinyasa, more powerful. I think it really allows you to practice body functionality and really empower how flexible and how balanced your body can be. And flexibility is like a skill. So it doesn't necessarily mean touching your toes. It's just having that you can move your body up and down, or like go into warrior 1 or warrior 2. So there's loads of research that yoga can improve body image from that sense of like gratitude. But also yoga can really improve IBS, or people that have got bloating or constipation, because a lot of the poses, we're actually, we're deepening and lengthening the inhale and exhale, which is moving along if you're constipated. But also a lot of the poses are like gentle back bends. So again, you're lengthening the torso. And also when we do yoga, we access the parasympathetic nervous system, which is the rest and digest. So basically that allows the body to slow down and get things moving. So Yeah, we've got improved gut health, body image, and then mindfulness as well. Because often in yoga, we're guided to really tune into our senses, which can allow us to be more mindful and bring that pause into our day, which I find I work with a lot of people that overeat, emotionally eat, or binge eat. And if they can learn how to introduce a pause in their day, that can really help them when they get that urge to binge or that trigger to emotionally eat. Once they start to practice that pause, and maybe it's not from yoga, maybe it's meditation, it can help them in that moment when they feel they need to surf. I call it surfing the urge, but when they're about to maybe overeat or binge eat. The type of yoga I do, so it's still like a vinyasa class or a yin class, but I might maybe my cues might be more like, can you feel your kidneys? And that sounds a bit weird. So maybe I'll be like, I'll guide you into like how you think your kidneys might look. So they might be like two balloons floating on your back, or they might be dark or light, or I might guide you into your bones. So like they're heavy and how do they feel against the ground? And I read the room, but if it's there, I also might guide some intuitive movement or free movement, because so often we're very pattern-based people, human beings, or we're very like, we like a routine, which there's nothing wrong with that. And we find safety in our routine, and our nervous system is all our patterns. But sometimes it's important to explore, how does your body actually want to be moved if you're not told how to move it? Like, what does that feel like? And most people, if they practice yoga a couple times a week, they probably have a certain way they go into sun salutation that they've just kind of learned over the years, but then they stop maybe actually thinking, how does this sun salutation feel in my body? And whenever I maybe get them just to close down their eyes and listen to whatever the tempo of the music is. I don't use lyrics, but I use like music with like no lyrics. How do you actually want to go into your sun salutation? Maybe you don't want to do it the traditional way. Maybe your body wants to do it and waving my hands like in a weird way. And it's really important that we explore how our body actually wants to be moved, not how it's been told to move.
Yeah, I love that. I love that. Thank you for sharing. And that's what, when we were in Bali, like ecstatic dance was a big thing there. I think it's like, it's not just obviously isolated to Bali, it's global, but that was my first experience of it, and it felt so fucking weird when I first did it. It was just like, oh, I felt kind of cringe. And I had done like loads of dancing like when I was in Bali, like was really healing for me because of that embodiment, because of like allowing my body to do what it wanted to do and being in my body. We're very like, and I actually noticed myself now, I've even the other day I was dancing and I was like, oh my God, I actually haven't been dancing in a while, and like sober dancing, because we can all like shake our booty when we're drunk. We can all we can get a bit more confidence on the dance floor. But I realized that I hadn't drank much one night, and then I felt myself almost feeling awkward, and I was like, okay, we need to do this a little bit more often. I used to just be in my house in Bali and just be playing music in the morning and just dancing around the place. And I was like, okay, I can definitely feel the difference with myself. And then I've even realized, yeah, and have noticed that shift, that I'm in my head quite a lot more often these days. So, we can be doing all the journaling, we can be doing therapy, counseling, all these different things, but it really is so important and impactful and powerful how often that you spend within your body. And I think a lot of people will just be like, I'm tired, I don't want to be in my body, I don't want to have to go for a walk, I don't want to have to do a yoga class. And it's like, start with the small things, like literally what you said, like a hand on your heart, a hand on your stomach, and taking a few deep breaths. That's like the number one thing that I encourage clients to do, is doing that 4-4-8 breathing pattern, that you're breathing in from your stomach, you're pausing at the top of your chest and following it back down, doing a body scan meditation. You could literally just be sitting on your chair right now if you're listening to this and you're sitting down, observing your feet, planting them on the ground, feeling like the roots in your feet, following it up, seeing kind of relaxation of the muscles in your legs as you're doing that, dropping the tension in your stomach, dropping your shoulders, loosening your jaw, etc. That can be something so quick that you do once or twice a day and can have a massive impact, because your body can shape how you show up in an environment, can shape how you feel within yourself. And it's really, really impactful at the end of the day. So thank you so much for sharing. And I love how you touched on stuff too, like body image and body gratification and what your body can do. I think a lot of the time people focusing on like weight loss or kind of like trying to improve their body image, they'll always think that they'll feel better when their body looks a certain way. But when you actually take a step back and think about how you feel, I always go back to this example of when I was at my lowest with my eating disorder. My lowest weight and my lowest mentally. I had just done like an 8-week challenge or something like that, and it was like really low calories, got really, really lean, had like tunnel vision for abs, and that didn't even happen. So it felt like an absolute failure. Everyone was giving me, external validation, telling me how small I looked and and God, you're working so hard. And then it was like this rock bottom moment that I was like, I thought this was going to bring me happiness. And it was actually when I started to put weight on afterwards, when I actually started to listen to my body a little bit more and started to go with the flow instead of trying to do 6 training sessions a week and 50,000 steps, that I actually started to feel better within myself. And I think I love what you said about feeling at one with yourself rather than feeling at war with yourself and feeling this disconnection. So many women are so disconnected from their bodies, and it breaks my heart, because at the end of the day, like, this is our body, this is our space, this is our home, and we're not getting another one, unfortunately. No, I'm only joking, fortunately, of course. But yeah, thank you so much for sharing all about your journey. Can you tell everyone where they can find you and reach out if they're looking for support?
Yes. Well, I'm gonna say first very quickly, if anyone wants to explore like intuitive movement, ecstatic dance, she's called Satu Yoga, and she does a class online called Shake the Dust, which I always recommend for like any newbies, because I'm trained in it now, I just haven't started doing it. It's yoga, Pilates, a little bit of HIIT, and a little bit of intuitive movement, so it doesn't feel as intimidating as like going straight into like ecstatic dance. And it's online, so you can do it in your own house. So that's on Instagram, Shake the Dust or Satu Yoga. And you can find me on at Roslyn Gray Nutrition. And our podcast is a therapist and a dietitian walk into a bar.
I love it. It's 11:11, by the way. Love it.
Meant to be.
Well, thank you so much for coming on, Roz. Everyone go give Roz some love. And as always, if you found this episode helpful, be sure to share it on with someone else, because they probably will. Tap the rating stars in Spotify and Apple if you have a minute. And yeah, we'll see you on the next episode. Bye.